Well, no, Gerald was John P. McIntosh, the MP in East Lothian's agent, and he later became a Labour organiser for the party nationally. He was the first women's officer of the Labour Party back in the innocent days before it occurred to us that the women's officer should perhaps possibly be a woman. A hugely loved member and member of staff of the Labour Party. But before he did all that, Gerald was an electrician, and we lost him some years ago to mesothelioma. But you know, you don't have to have been 40 years on the tools to suffer from this disease. Another constituent I knew well for a short time, Jim Anderson, was a teacher in my constituency for many, many years. But as a student, he had spent one summer labouring on the construction of Cockenzie Power Station, and 45 years later, mesothelioma came back and took him too. And in a blog that Julie wrote, I think just in the past few days, she said something which I think was very important about her dad and her uncle, that all they did was go to their work. They didn't do anything wrong, they just went to their work. This was a disease that they didn't inherit from their parents or grandparents. They didn't catch it from their neighbours. They didn't do it to themselves by drinking or smoking. Those who suffer from this disease simply went and built the power stations, the ships, the factories, and the homes that we all wanted. They did that to provide for their family. They did the right thing and paid a terrible price. And this is probably nonsense, but it's always seemed to me that this is a disease which takes the biggest men. I know it's not only men, but it seems to me that it picks out those men who have particularly the most life about them. Now, I didn't know Julie's dad, but I've heard her speak about him in the film My Life with Hibbs that she made, and he sounds like that kind of man who would fill the room with his strength and stature and love of life. And this is a disease which takes that strength and stature away, and then it takes your breath away, and then it takes your life away. So what do we do? I think we have to respond in three ways, and they've all been mentioned this evening. The first is to make those responsible take responsibility. The employers who carried on making their workforce work with asbestos when they knew fine what the consequence was. There are insurance companies who have tried every trick in the book to avoid paying compensation to families. Secondly, we have to respond by making sure it doesn't happen now and fight tooth and nail to defend health and safety at work so that we do not see this disease come back again in yet another wave. And finally, of course, we have to ensure that mesothelioma is given the medical attention that it needs. Correct the shameful lack of specific services highlighted by Anas Sarwar and by Kezia Dugdale. And that, I think, is the question we put to the Minister tonight.
I now call on Aileen Campbell to respond to the debate. Around 7 minutes, please, Minister.
Thank you, Presiding Officer, and I'm pleased also to be able to close tonight's debate and, like all the other speakers this evening, congratulate Kezia Dugdale on bringing it to the Chamber. And also would like to put on record my welcome to Julie Roberts and her family to the Parliament and pay tribute to the family for what they've done in honour of Gordon and Jim to campaign for the improvements they feel is necessary to ensure that their lives haven't gone in vain and their untimely deaths can ensure improvements for others across our country. Members have talked about the impact this condition has had on their constituents, tragically cruel in so many ways, and many of whom have contracted the disease simply by going to work, or the partners who have contracted secondary mesothelioma through simply washing overalls. And like the motion states, I also pay tribute to the campaigners, the trade unions and the charities who have done so much to support those with mesothelioma who have brought about the improvements or changes needed and who have raised awareness of the condition. I also welcome the report by Mesothelioma UK's publication and their strategy aims seeking to make further improvements to care and support across the UK for those who contract mesothelioma, including raising the profile of it to prevent future cases of asbestos-related disease. And we recognise the work carried out by a host of other organisations, in addition to Mesothelioma UK, such as Clydeside Action on Asbestos, Tayside Action and Clydebank Action, who as Stuart McMillan pointed out, provide advice and support to people with asbestos-related disease. And also in the case of Clydeside Action on Asbestos, provide resource, as Stuart also mentioned, to GPs and doctors about the wider implications of this cancer. And it's on that theme of our wider approach to cancer that I want to make my remarks. We all know and recognise that progress has been made on treating cancer and survival rates. And this is largely thanks to the hard work and the endeavours of those who work across the NHS delivering our health and social care services. But we also know that there is room to do far more, particularly in cancers that have an unfortunate link to deprivation, or in this case, in terms of mesothelioma, cancer caught through industrial work. And in March of this year, the Scottish Government unveiled its Beating Cancer Ambition and Action Strategy, which serves as a blueprint for the future of cancer services in Scotland. And while the cancer strategy, as many have made reference to tonight, did not specifically mention mesothelioma, this should not be taken for a moment as a sign that improving the outcomes for people with mesothelioma have not been considered. The Scottish Government is acutely aware that early detection of all cancers, including mesothelioma, is crucial. The earlier that cancer can be diagnosed, the better the chance of a more positive outcome. And the cancer strategy will deliver £100 million worth of investment over 5 years to improve the prevention, the detection, diagnosis, treatment and aftercare for all those affected by cancer. And this will have a positive impact on all of those affected by cancer, including those with a confirmed diagnosis of mesothelioma. But of course, we will again consider the implications of the Mesothelioma UK report within that wider context of that wider strategy, and also look at what lessons can be considered within the context of the current waiting times work. Can I just, because I will give way, mesothelioma, though, for the benefit of the members, is under consideration for extending tumour audit for cancer waiting times, and I'll make a commitment to update members who have expressed an interest tonight on how that audit process goes.
Kezia Dugdale.
Thank you. Can I welcome the Minister's investment in the cancer strategy and also specifically her remarks about early detection and how important that is. I therefore wonder if tonight she could commit to a public marketing campaign focused on people who are exposed to asbestos, so we can make sure that those people in those communities exposed to asbestos do get the early detection that could save their lives.
Aileen Campbell.
Like I said, I'd committed to making sure that the strategy took on board the implications and the recommendations and the strategy aims of the Mesothelioma UK report, and will again, continue to engage with other members who have expressed an interest in this to ensure that we get that right for people who might have or potential to have mesothelioma or asbestos-related diseases, and we'll do that within that wider context of that £100 million investment. In addition to that work that I've outlined around this cancer strategy and to help support GPs to promote earlier referral or investigation of patients who may be showing a suspicion of cancer, in 2014 we also published revised Scottish referral guidelines for suspected cancer. And these guidelines include a specific section on mesothelioma and should help GPs, the wider primary care team and other clinicians, patients and carers to identify patients most likely to have cancer and who therefore require urgent assessment by a specialist. So again, perhaps there is opportunity and scope to consider much more widely the ways in which we could actively and more proactively advertise and target people who might have that potential to have or suffer from asbestos-related disease. Other members who contributed to tonight's debate included Miles Briggs, who raised the issues around new drugs and the potential that that can bring to those who suffer from asbestos-related disease, and obviously will ensure that within that our wider strategy around drugs and cancer, that will be part of the focus. And Emma Harper again brought her experience as a nurse and of course her own friend's experience to tonight's debate, and it's useful I think to hear about the cross-party group that she has set up to provide a much more longer-term parliamentary focus on lung health, which will include, as she's confirmed this evening, mesothelioma, and I'll commit to working with her to ensure that we can identify further areas of improvement or opportunities to do more on this particular issue. Very, very briefly, if you can.
Anna Sarwar.
I apologise it's so late in your time. Minister, I thank you for your comments. Just specifically on mesothelioma, can the Minister commit the mesothelioma will be included in the waiting time targets, that will look to have a standard for mesothelioma treatment, that the hub that's in the west of Scotland will be extended to across the whole of Scotland, and that there will be direct research funding specifically for mesothelioma research in Scotland?
Aileen Campbell.
I already made reference to the waiting times work, about that wider consideration that's already going on into waiting times, the links and what we can learn from the points that have been raised tonight, the wider Mesothelioma UK report and what that will mean for not only the cancer strategy but waiting time work, and also the current audit about the extending tumour audit and the cancer waiting times, that wider bit of work as well about how that will relate to the points that have been raised this evening and the debates and the comments that people have made. I just wanted to finally touch upon, though, Presiding Officer, if I can, I'm well over my... Okay, yeah.
Stuart McMillan.
For taking the intervention, and also yourself, Presiding Officer, for allowing it. Can the Minister confirm that in terms of because the Minister spoke about nurses earlier, and can the Minister confirm that lung cancer specialist nurses actually adhere to the same care plan for people with mesothelioma as do mesothelioma nurses?
Aileen Campbell.
And to pay tribute to Stuart McMillan's knowledge and expertise and his campaigning that he's done on this issue for the constituents that he's represented in his constituency now, but also across the west of Scotland, and can confirm that nurses do adhere where they can to the same standards for lung health, and the point that he raised. Just finally, though, I wanted to just point on the issues that Jackie Bailey and Ian Gray raised around the prospect of looking at recovering funds from those who cause cancer. And again, we'll take that on board and ensure that they get kept up to speed with any progress that can be made on that. But I also wanted to note the Scottish Government and the Scottish Parliament have indeed, though, a strong record in supporting those who have been negligently exposed to asbestos. And significant provision regarding the law and damages for personal injuries has been made over the years, including a number of bits of legislation, with most recently the Damages Asbestos-Related Conditions Scotland Act 2009 and supporting the Damages Scotland Act of 2011. So, in closing, I would like to offer my thanks to the members for their contribution to today's debate. We have seen significant progress in relation to cancer, but we know that we need to do more so that people like Hope Robertson and others like her can understand that their voices have made a difference in how we approach this condition, and especially when it comes to the improvements that they want to seek. The cancer strategy will assist with this, but it will require us to work together and collaboratively with third sector organisations, with charities, with trade unions, with other members who've expressed an interest in tackling mesothelioma and other asbestos-related conditions that are unfortunately far too prevalent across our country. Ian Gray reminded us of the importance to get this right for people who are suffering asbestos-related diseases, because they've only got it because they went to their work. So we owe it to them to do what we can to raise awareness and to make the improvements needed to ensure that we can have a better story to tell going forward. We've come a long way, but there's absolutely room for improvement. So thank you.
I close this meeting.